My name is San Bilal. I'm the director, and Philomena asked me to say just a few words to welcome you here. It's nice to see you, so many here in our office, and so many as well online. I have to say, on a personal note, and I had in fact these discussions yesterday with a couple of policymakers. We were quite puzzled by the fact that while global health is such an important topic, that we had the COVID-19 that really showed how important it was, and that we're saying, well, we could have new pandemics, we have to be better prepared, and so on, that the issue of health in general seems to be just declining, and that people don't seem to pay attention to it. Funding is cut, and that it seems more and more difficult to gather resources and energy for addressing a human challenge that we have ahead of us, and we know it is coming. So I know we live in a very difficult world where we see many crazy things and unexpected comments from climate to the situation of the world by some of the actors. But it is quite amazing that this such an obvious topic, and I think I would not have thought 2 or 3 years ago that I would start a meeting on global health saying, well, we have to rally and to join forces to push the agenda, because it seems to lose the momentum among a lot of policymakers and even around the population. So this is really something that makes perhaps the kind of events that we're having today, and also joining forces, even more important. We would talk on a lot of issues, coalitions of the willing, and I think that on health, more than ever, it is important to have a coalition of the willing and to try to gather our forces together, but also go out and preach to those that not perhaps preach, in fact, to try to give them convincing arguments of why health, even if they are not health experts, even if they think they should not matter and so on, it is of concern for the future of what we're trying to do, irrespective of, from security, from our well-being, for our economic development. So let's take whatever angle we want to, but we absolutely have to convince, and I think as the health community, we have to do jointly a better effort to try to convince the unconverted and about the importance of what we're doing. So we're especially happy at ECDPM that together with the AIDS funds, one Global Health Advocates and the Friends of the Global Fund Europe, we are coming together to try to address this question. And today, and I'll stop there just with my warning, but we are very happy to have you all here to discuss the Global Fund, ECDPM today, and congratulations, Philomena and the team. We published also a paper outlining some of these elements, and I leave the floor to Philomena, who is the one behind all this organization with the many colleagues. Philomena, the floor is yours.
Thank you so much, San. Really wise words being said about the need for the collective. So good morning, participants. To those joining us online, good afternoon, good evening from wherever you're joining us. It's really wonderful to see so many faces in the room here. So thank you for making the trip this early in the morning. So just to start us off, my name is Philomena Pico. I'll be the moderator for today's event. I'm a policy analyst here at the ECDPM, leading our work on health. And together with my colleagues Katja van der Meer and Pauline Veron, we work on the health team and have published this paper. So please, when you leave, do look on our website and access it. And I want to thank our partners, as well as San mentioned already, AIDS Funds One, Global Health Advocates, and Friends for the Global Fund Europe. So just looking at the time, I would like to take this moment to invite our keynote speaker, the ambassador of Ghana to Belgium, Luxembourg, and the head of mission to the EU, Ambassador Tachie-Menson. We welcome you.
I can have a seat. Thank you, and good morning to you all. Well, since there's no podium, I'll take a seat if you don't mind. Good morning to you all. It's my honor to join you today, today's conversation on health sovereignty, and I commend the ECPDM 8 funds, 1 Global Health Advocates, and Friends of Global Fund Europe for choosing to spotlight the matter only a few weeks after a historic Health Sovereignty Summit convened by His Excellency the President, President Dramani Mahama, President of the Republic of Ghana, in Accra. The level of participation in this meeting reflects the importance of health sovereignty, the growing interest in the subject, and the increasing appetite for collective action to make Africa less dependent on the benevolence of others for the continent's most critical health needs. In the last few years, the issue of health sovereignty or independence has continued to gain momentum for very good reasons. The experience of the COVID era showed that at the most critical moments, health independence dictates responsiveness to the plight of ordinary people who lack access to basic health services. Excellencies, the bitter experience of losing lives during COVID-19 as a result of limited access to vaccines and medicines reignited a desire to achieve self-reliance and global health equity across the African continent. By this, the ambition is to empower our countries to control our own health systems, finance our health priorities through internal generation of funding, and produce vaccines and medicines domestically. We expect our efforts to shift towards health sovereignty to generate tangible and intangible outcomes for this generation and future generations. First, control over health systems and programs allows resources to be distributed on a need basis. Second, local manufacturing of medicine and vaccines ensures availability and increases access. Third, local production creates jobs and employment and therefore impacts local economies meaningfully. Beyond the benefits to local economies, African countries will also be in a position to contribute towards the resilience of the global economy. Now, at the regional level, African leaders fully appreciate these benefits that stand to accrue from health sovereignty and have taken important steps towards reversing the conditions that perpetuate dependence. This has resulted in several commitments and regional initiatives ranging from the publication of new public health order to the Abuja Declaration's bold pledge to allocate 15% of national budgets to health, the Maputo Plan's commitment to prioritize health needs of women and children, as well as the African Leadership Meeting on Health as an investment also show proactive leadership geared towards effective and resilient health systems on the African continent. All these important steps have laid a strong foundation for actions that seek to concretize the idea of health sovereignty. The regional efforts, including the African Health Strategy 2016 to 2030 and the Abuja Declaration, inspire each African country to work towards operationalizing national commitments. The AU's efforts therefore consolidate and amplify national ambition instead of replacing them. What the continent hopes to do is to institutionalize a coordinated African-owned system through the African Center for Disease Control, the African Medicines Agency, and the upcoming African Humanitarian Agency. These institutions and others, such as the African Manufacturing Vaccines Accelerator and the African Pooled Procurement Mechanism, all seek to provide a robust foundation for self-reliance in health manufacturing for the continent in the wake of its growing role in the global health ecosystem. The coordinated approach adopted by the region holds many promises, including addressing fragmentation of efforts and improving Africa's bargaining power. Now, there's a portion on Ghana's leadership, which I will skip, but so that it doesn't prolong the presentation. So various stakeholders use the occasion, so now on the summit, which was held in Accra. At the summit, various stakeholders used the occasion of the conference to reiterate the concerns about the global health systems and Africa's responsibility to reduce or eliminate the external factors that control the continent's health system. Many speakers call for African leaders to work towards activating the financing, equity, and solidarity revolutions. As key outcomes, the Health Sovereignty Summit endorsed the Accra Initiative. So the outcome was the Accra Initiative. Initially, it was the compact, but we have not gotten to that level yet because we have to agree on everything, but we haven't. So the outcome is the Accra Initiative instead of the compact. So As key outcomes, the Health Sovereignty Summit endorsed the Accra Initiative, which spells out Africa's vision for health sovereignty and a more equitable global health order. The initiative aims to reposition Africa at the center of global health governance and ensure policies that reflect African priorities. At its core, the initiative sets out a continental vision for health sovereignty and calls for enhanced domestic resource mobilization. So the ensuing points I'm raising are contained in the Accra Initiative. So the initiative places health within a broader agenda for stimulating investment and economic transformation. In this new paradigm, health is treated as a foundational sector that strengthens labor productivity, drives innovation, and catalyzes value chains across diagnostics, biotechnology, pharmaceuticals, logistics, and digital infrastructure. Health serves as a strategic lens through which wider continental ambitions for industrialization, trade integration, and geo-economic sovereignty can be pursued. Through the Accra Initiative, Africa is committing to the following principles: improve continental leadership, national accountability, and institutional resilience, and ensure equity, transparency, and inclusive participation in decision-making, ensure inclusive participation of low and middle income countries and civil society, ensure inclusive participation of low and middle income countries and civil society, secure diversified sustainable finance from domestic, regional, and private sources, position health as a productivity and innovation driver within economic policy, embed African-led standards, data sovereignty, and manufacturing in continental value chains. Foster cross-sectorial collaboration to address interconnected challenges in health, economy, and security. The Accra Initiative further agreed on a strategic outcome that includes the formation of a presidential high-level panel for further engagement and inclusivity on the framework of a reimagined global health architecture and a roadmap for national implementation and strengthened coordination with international development partners for a smooth transition. Another important milestone was the launch of SUSTAIN. SUSTAIN means scaling up sovereign transition and institutional networks. So another important milestone was the launch of the SUSTAIN initiative to promote country-led and investment-driven systems powered by domestic resources, private sector engagement, philanthropic partnerships, and technical expertise. This initiative aims to bridge the funding gap arising from declining external aid by mobilizing domestic resources and engaging private sector. SUSTAIN will further serve as a vehicle for a broader reimagining of Africa's place in the world, linking sovereign health systems to wider capabilities in trade, data governance, and industrial policy.
I just wanted to find out, just to say, are you about to wrap up?
Yes, I'm wrapping up.
Thank you, sir.
Okay. I think I'll be getting to the conclusion soon. African leaders understand that translating Africa's commitments and ambition into action requires that African countries establish strategic international partnerships that rely on support from both public and private sectors. The impact of the work of Global Fund and the outcomes of partnership with key partners such as the European Union, Gavi, WHO, UNAIDS reinforce this notion. The Global Fund in particular is obviously one of the most important partners central to the idea of health sovereignty. Since 2002, the organization has disbursed over $6 billion for critical health interventions. The support the fund provides for health systems in Africa include digital health systems, contributes towards making entire health systems more robust and efficient. I think there are more, but the paper is available, so I'll leave it for you. And then, thank you very much.
Thank you so much, Ambassador, for this keynote remarks. Really setting the scene for our discussion today. As you can see, the continent itself is taking initiatives towards more health sovereignty and sharing this with the leadership of the Ghanaian President Mahama. You see that the actually efforts are being made together with partners like the EU and the Global Fund, who are here today to discuss with us. So I'd like to thank you, Ambassador, for this. We're really grateful that you're able to give the keynote speech at the event.
Thank you. Thank you.
So we're 20 past time, so I'll try to now be more Dutch about the time. Katya. I would like to welcome my colleague Katya, who will do just a really brief summary of some of the key findings of our presentation before we open it up to panel discussion. Thank you.
I promise to be very, very brief as soon as I manage to get the presentation up. So we are running to our first technical problem. But I guess before that, yeah, I can introduce myself. So I'm Katja van der Meer. I am here one of the authors of the report that is being launched today. In this presentation, I am planning to run you through some of our key findings, as well as, of course, our recommendations. Let me see. Yeah, okay. I guess I'm gonna start without presentation then. Great. The objective of this study was to analyze the Global Fund's contributions towards achieving health sovereignty in Africa. We identified some opportunities for greater alignment and, yeah, okay. There we go. For greater alignment and enhanced cooperation with Team Europe and through Team Europe initiatives and in the context of Global Gateway. We acknowledge the broader, often critical debates on global health initiatives, but our scope was to actually focus on where the added value lies, where are the opportunities for better cooperation. I am going to do this. Yeah. Woohoo! I know. So things are happening. Great. So on Global Fund, it is one of the largest multilateral grants provider for health in low and middle income countries. Since its inception, it has dispersed $65 billion over to support programs in over 100 countries to fight HIV, tuberculosis, and malaria. Around between 2023 and 2025, around 72 of its allocations went actually to Africa. So how does the Global Fund contribute to health sovereignty in Africa? It does it in broadly two levels. One of them on the continental level, it aligns with the AU's key frameworks. It collaborates with AU Commission, Africa CDC, and AUDA-NEPAD. And by anchoring its support to the Africa's continental frameworks, the Global Fund is able to reinforce the African institutions' capacity to lead and coordinate health responses, and in that way reduce fragmentation. Global Fund also supports regional manufacturing and procurement. It is the larger procurer of HIV, malaria, and tuberculosis commodities, and therefore it can play a critical role in manufacturing. While the Global Fund doesn't directly manufacture or doesn't fund manufacturers, its volume in procurement, and it can build capacity through procurement, so therefore it has indirect value on manufacturing. Global Fund also supports regulatory systems. So for example, it has supported regulatory authorities in African countries by strengthening their technical, financial, and institutional capacities. On national level, the Global Fund fosters country ownership. It aligns with national health plans. It supports domestic revenue mobilization. And around 20 to 30% of its support goes to strengthening resilience of health systems, for example, through strengthening supply chains, strengthening community health systems. I'm going to be very brief about the EU's approach to global health, but in a sense, it's best detailed in the EU's global health strategy that has three big objectives of delivering health and well-being, strengthening health systems, and preventing and combating health threats. Health is also one of the key areas of Global Gateway, and there are 5 regional team-up initiatives focusing on health. So when we did go through the political priorities and strategies of Global Fund and EU, we saw that there is clear alignment in policy level in many domains. Yet at the same time, we noticed in our interviews that there could be a bit more room to search for concrete synergies. So exploring those synergies, on the context of TEI, Team Europe initiative on manufacturing and access to vaccines, medicines, and health technologies in Africa, or as the French call it, MAF+, there is a clear added value of Global Fund. The Global Fund has strength in procurement, and it can potentially foster predictable demand for locally manufactured products. Our interviews also constantly brought up lenacapavir. It is a breakthrough HIV prevention medicine, and Global Fund plans to reach at least 2 million people over the next years. EU could provide support for the local production and proper rollout of the drug. On SRHR, we also saw some potential for synergies, provided that both EU and Global Fund have strong approaches on gender equality and focus on adolescent girls and women. Aside from the TEIs, there are also opportunities on EU's and developing countries joint undertaking on clinical trials on ECDPM, for example, in the case of malaria work. But investing in Global Fund and global health in general is not only about concrete synergies. It can also be thought of as a strategic move from the European side. We live in a world, as our keynote speaker and San has noted, where future pandemics are actually inevitable. Investing in global health, therefore, is a strategic necessity for European actors. It can also be a key factor in strengthening Europe's and Africa's partnership on health. Furthermore, our analysis shows that Global Fund can be a strategic channel for influence, an opportunity for the EU and European actors to demonstrate their commitment to multilateralism. Finally, there are some economic benefits. So for example, for EU and Africa. So for example, European companies provide, let's say, benefit roughly 3 billion annually from procurement contracts with Global Fund. So going to our recommendations. First of all, Team Europe should adopt a little bit more of a strategic approach for Global Fund, to see it as a catalytic way to increase also the impact on health of Team Europe itself. It should align with Global Fund's existing support to Africa and reduce the fragmentation in that way, to find the synergies, find the place of alignment, and find the cooperation from the coalition of willing, as said. Secondly, the EU could benefit from adopting a more joint voice when it comes to the approach towards global health initiatives through Team Europe. And of course, it is important to secure predictable funding for health in the new Global Europe instrument. On Global Fund, just like the EU, also Global Fund would benefit from exploring synergies with the European actors. It could map the support given to the key areas of EU policies in Africa and seek to deepen engagement with relevant EU-funded initiatives. Furthermore, We think that Global Fund could explore the strengthening the use of blended and innovative financing to complement its grants and scale up support for Africa's health sovereignty. And then finally, the African stakeholders. Our recommendation is that there is still more room to capitalize the momentum and reforms that were considered in African Health Sovereignty Summit. African stakeholders should also leverage both the support from Global Fund and Europe and rely on their respective strengths. Finally, African stakeholders and partners could strengthen their accountability mechanisms and track health programming, financing, and implementation. I'm going to finish here because I want to have time for the speakers as well. So thank you very much.
Thanks so much, Katja, and on time. So thank you for that. So I would like to now take this moment to welcome our esteemed panel to take the places on the podium. And I will then, we just to mention, we are joined by two speakers online, Mr. Wessam Mankoula from Africa CDC and Ms. Janet Byaruhanga from AUDA-NEPAD. So they'll also be giving interventions today. And I can sit here. I can also stand, but I don't want to be like a teacher. So just to check, Wessam, are you online? Yeah. So let me do a quick introduction of our speakers. I'll keep it brief so we can jump right into it. So as I mentioned, we are joined by Mr. Wessam Mankoula from Africa CDC. He's the regional director for the Northern Regional Coordinating Center, RCCs for those who know the acronym. And he leads the emergency operations at Africa CDC. He was part of the group that was actually tasked to come up with the conceptualization of Africa CDC when the AU started. And he's led several missions related to pandemics, including on Ebola, Rift Valley fever, and also cholera. And then we're joined by Janet Byaruhanga, who will also be joining us from AUDA-NEPAD. Most of you may know Janet because she's a very seasoned health expert who has been working on issues around regional manufacturing with the pharmaceutical plan for Africa, but also around regulatory harmonization with the AMRH. So she's joining us today, and she's also one of the brains behind the 24 priority medicines product. So those of you who know about this, she's one of the team behind this. In front of me, I'm joined today by four esteemed guests. I will start from the gentleman. We're joined by Martin Seychell. Martin's Deputy Director, responsible for the directorates dealing with human development, migration, governance, and peace in DG INTPA. And previously, he was DG for health in the Health and Food Safety Directorate, DG Sante, for those who use acronyms more. And he's a he has a history also dealing with public health and health systems products, so quite a vast expertise. Thank you, Mr. Seychell. And right next to him is Marit Mai. Marit is a member of the EU Parliament, so she holds very many hats, but I'll just mention a few for the audience today. She sits in various committees, including the Committee on Budgetary Control, the Committee on Employment and Social Affairs, the Delegation on the CARIFORUM EU, the Delegation on OACP's EU Joint Parliamentary Assembly, as well as Delegation to Africa EU Parliamentary Assembly. Thank you for joining us, Marit. Next to Marit is Ada Faye. Ada is the Chief Financial Officer at the Global Fund, and she's leading the Finance and Administration Division, where she oversees financial management and administration functions. She plays a key role in ensuring the adequacy and effectiveness of internal controls, while also protecting and optimizing the financial resources to accelerate the Global Fund's mission on HIV, TB, and malaria. Thank you, Ada. And last but not least is Mayel Ba. And she's a strategist and advocate dedicated to advancing health, equity as well, sustainable development agenda. She's an advisor at Speak Up Africa, where she leads high impact communications. She's also a co-chair of the RBM Partnerships to End Malaria, which was in 2023. And she's a champion for gender equality and grassroots. So we're very, very fortunate to have a collective of insights on the panel today. So I'll take my seats just so I could be like a school teacher with the microphone, but I'll sit. So I'm not sure if Wessam has joined, so I will start with Janet, who's joining us online. He's joined. Good morning, Wessam.
Good morning, Philomena. How are you?
I'm fine, thanks. Thank you for joining us. I know you traveled as well recently. Just got back to Addis, so thank you for making it to the event. So we heard from Ambassador the developments that are happening on the continent around Africa's health sovereignty. We heard about the initiatives being led, even with a high-level panel. So I wanted just to go a little bit backwards towards what the Africa CDC is doing with a new Africa Public Health Order, because we know this initiative has been quite a key force in driving Africa's move towards health sovereignty, including around issues of expanded domestic financing, respectful partnerships, but mostly, I think most people know it for also the driving force behind the regional manufacturing on the continent. Could you please share with us, the audience, where we are in terms of this meeting the objectives of this public health order, and what partners like Global Fund and EU could do to support this? Thank you.
Okay, thank you, Philomena, for this important question. Let me start with thanking Dr. Samplan, the Executive Director of ECDPM, for organizing this important forum, and also Ambassador Henry Menson, all protocol observed. And before answering your question, I think Dr. San asked the question at the beginning, what happened after COVID-19? Why we tend to forget the problem, this pandemic, and return back to normal, funding declining. Unfortunately, this is not the first time we're forgetting. It seems that we have a chronic disease called pandemic Alzheimer. Every time we have pandemic, everyone is engaged. Once the pandemic is over, we tend to forget. This happened with SARS 2002, 2004. Everyone engaged. Later on, once it's concluded, we tend to forget. Swine flu 2009, the same happened. And now it's COVID-19. So we have this kind of pandemic Alzheimer, and I'm not sure if we'll have a cure for this pandemic Alzheimer. And let me move to the new public health order. When we speak about new public health order in Africa, we're not speaking about priority action to be conducted, but we are speaking that Africa mainly taking charge of its destiny. And this is what is important about this new public health order. Africa putting the priority to move as a one continent together to strengthen the public health capacity in the continent. And we have 5 pillars to move in this agenda. First one, building African institution at different level. At continental level, similar to Africa CDC, at national level, National Public Health Institute. And we are happy with the progress that we have conducted as Africa CDC since establishment of Africa CDC and official launching 2017, that make our heads of state and government put their trust in Africa CDC into 2022 to expand the scope of Africa CDC to become autonomous institution, and also to give Africa CDC the mandate to declare public health emergency of continental security. The same, what we are doing as Africa CDC, supporting our member states to have at each one of our countries National Public Health Institute, or CDC, at each country, where all public health functions should be housed within one institution, including emergency operations center, surveillance, central public health laboratories, workforce development, research as well. So this is what we are looking for under the new public health order when it comes to strengthening the institutions that focusing on public health in the continent. And second one, and this is a critical agenda for Africa CDC, the local manufacturing agenda. And unfortunately, we learned the hard lesson during COVID-19. And during COVID-19, we were not looking for donation for COVID-19 vaccine, but maybe one of the first time that Africa secured $2 billion under vaccine initiative led by Africa CDC and African Union, and we're ready to procure COVID-19 vaccine. But unfortunately, Africa left at the end of the queue to get access to this COVID-19 vaccine. This is why it was critical to focus on local manufacturing agenda, to have this bold initiative by 2040, 60% of the needs of the continent to be locally procured. This is not dreams. We have now around 25 vaccine initiatives happening in the continent at different stages, around 560 drug manufacturing facilities, and also diagnostics facility. And in this regard, we are happy that Global Fund, and this is for the first time, to start procuring African-made HIV products produced in Kenya, and also procuring also African-made HIV diagnostics, self-testing produced in South Africa. And this is very critical to encourage the local manufacturing happening in the continent. And moving from the procurement part to the financing element, at the beginning of this year, we launched Africa Financing in a new era, focusing on domestic financing, blended financing, innovative financing, and this initiative led by His Excellency Paul Kagame, President of Rwanda. So we're bringing heads of state, we're bringing our ministers to lead this agenda forward and push this agenda of domestic financing in the continent. And in this regard, well, yes.
Yes, I'll choose to conclude, yes.
Yes, and in this regard, we're building on also the collaboration and support from different partners. We are happy with the engagement with the European Union and Team Europe. We have many ongoing initiatives, and we're looking forward to expand those initiatives. At the end, our message is clear, that we're not looking for charity, we're not looking for donation, we're looking for respectful, action-oriented partnership to achieve the sovereignty in Africa. I thank you.
Thank you so much, Wessam, and really ending with a clear message about the vision of Africa to more action-oriented partnerships. So thank you for this. Maybe just building up on this, I would like to then invite Janet to give her intervention. Janet, are you online, Janet?
Yes, I am. Thank you.
Okay. Thank you so much, Janet. Just following up from what Wessam has shared, as they're working for AUDA-NEPAD, which is the implementing agency of the African Union, how in your perspective can African actors, together with partners like the EU and the Global Fund, be able to engage and achieve implementation of the continental's priorities, while at the same time ensuring that Africa remains in the driving seats according to what the priorities have been identified? So maybe from your experience at AUDA-NEPAD, how this could go about. Thank you.
Thank you. Thank you very much. And all protocols observed. To not take a lot of time, I would like to first take you back to the 2001 era, when all this discussion around financing Africa's health began. Then moving on to 2002, when the Abuja commitments on the 15% allocation to health began. Then 2005, when the decision to develop the African pharmaceutical manufacturing plan for Africa began. All of these historical instruments that have been developed, like in 2009, when the African Medicines Regulatory Harmonization Initiative began. There's so many initiatives that have mushroomed, and in fact, after COVID as well, as you have heard from the Africa CDC. The idea now for us to be successful, the idea should be that all these initiatives, all these programs and projects should really be speaking as one voice. What I have noticed as a person who has worked within the AU from 2007 to date is that each time we, instead of building on existing programs, we develop new ones. And this is not enhancing or making good use of the minimum resources that we have. So I would like to speak to 4 main points. One, again, is for us to speak with one continental voice. Can the AU endorse frameworks be used as a reference point in all engagements with our development partners. That means including EU, that means including the Global Fund and several others. This would ensure us to align with Africa's collective priorities rather than the fragmented initiatives that are all over the continent. Number two, we need to insist on programmatic alignment rather than parallel projects. Here, I would like to emphasize that we are requesting Global Fund and the EU investments to be channeled through, for example, AUDA-NEPAD, the Africa CDC, AMA, the regional economic communities. Those are already existing structures that have been put together on the continent that we can really help prevent duplication and ensure that Africa is on the driver's seat of coordination. Thirdly, let us negotiate conditionalities that build local capacity. Here, I know that Global Fund, you've been procuring for HIV products. Make sure that the procurement support is conditional on, for example, technology transfer, local skills development, and regulatory system strengthening. For example, for every antiretroviral or malaria medicine that is procured with your donor funds, can part of that spend should support African producers on the WHO pre-qualification path, for example? Fourth point, can we push for blended finance structures? I believe you have mentioned the billions of money that have been invested in Africa, especially to address HIV, TB, and malaria. Can we advocate for these funds to be used as de-risking instruments? This is about the grants that you give us, the guarantees, and sometimes concessional loans could be used in order to de-risk the SMEs that are trying to invest in building their local capacity to produce the essential medicines that we need. The last point that I would like to emphasize is how can we secure demand commitments from African manufacturers? We want the Global Fund and EU to set aside a portion of their procurement budgets for African-made products once they meet the standards. I know you've mentioned about Mozambique and Kenya. That's one example, but there is a lot of room for improvement in the manner in which we can do this in order to support the local capability for manufacturing. Because without the market certainty, Africa will not sustain our local production agenda. Lastly, this is my final sentence. We would like our partners like EU and the Global Fund to work with us in building Africa's pharmaceutical future, not as a parallel project owner, but as co-investors who strengthen African institutions, build African factories, and buy from the African manufacturers. This is how global solidarity then translates into true African ownership. I would like to thank you.
Thank you so much, Janet, for sharing these points. I really like the points where you were listing quite clearly as an implementer what it would take, not just from the financial, but also the demand side from the procurement. Even just from the starting point, how to ensure that the funders are looking at the priorities from the African strategies themselves. So I think this sort of sets the tone for now the discussions that I want to move to our next speaker, who is Mr. Martin Seychell. Probably everyone in this room has heard about the Global Gateway, and most of you online, I'm sure. We've heard also from the recommendations of Kacha the need to avoid fragmentation, the need to work with other actors beyond Team Europe. So my question to you is, how can the EU improve its collaboration with non-EU actors to ensure success of the Global Gateway ambitions for health? I know regional manufacturing is one of these support programs under the Global Gateway, to ensure cooperations with global health initiatives such as the Global Fund, but also avoiding fragmentation, as we've heard from Janet and Mr. Wessam earlier. Thank you.
Thank you very much.
Slide it to the side.
Should be on now. Okay, so thank you very much. Good morning, and thank you for the question. First of all, before I dive into your question, very quickly, just to reassure everyone that, at least for us in the European Commission, health remains very much a priority. Yes, of course, at the moment, there are many, many other priorities as well, security, climate, and also, you know, a lot of other issues. But as you may have heard also in the State of the Union speech, President von der Leyen made a very specific reference to global health resilience. So definitely, whereas maybe, of course, global health is not maybe the first item on the agenda these days, let me assure you the antibodies are still very strong and are there. Now, coming to your question. First of all, the starting point for us, when we talk about non-EU actors, the starting point has to be our partner countries. That is the point of departure and the point of arrival. And we have to also to look at also how we can best support their vision. We have heard a lot, rightly so, about the concept of health sovereignty. I think that was one of the main lessons learned, not just from the pandemic, but from any good analysis of the current situation. It is a very dangerous situation to be in for any country to be completely or largely dependent on external support for the provision of basic health services. This is a situation of vulnerability, and vulnerability is the opposite of sovereignty. So this is clearly why we obviously support the moves, and a lot is happening, certainly in Africa, but also in other places, because the concept of health sovereignty is also an issue globally. Now, this is important also for Europe. One thing I'd like to emphasize here is that we support this, not just because it's the right thing to do, but also because it is very much in Europe's interest. First of all, we know the threat from especially communicable diseases. You know, if left unaddressed, these very rarely self-resolve. They tend to spread. But it's not just about infectious diseases. It's also about the non-communicable diseases. One of the challenges many countries around the world face, including in Europe, but also many of our partners, is how to translate economic growth into prosperity, because they are not the same thing. And countries are realizing more and more that if they do not find effective ways to channel economic growth into the well-being of their populations, this will lead to various phenomena of instability, of uncontrolled migration, many issues which then tend to multiply. So we have a big interest in supporting countries to translate economic growth into prosperity, and one of the best ways to do it from our own European experience is to invest in health systems that are equitable, that are efficient, and that are resilient. The third reason why we do this is because Europe has, I believe, a lot to offer. It's experience of decades where health is seen as an essential, the provision of health services is seen as an essential function of the state. This is something which has served us well in our history. It is an area, it is an aspect where there is, I would say, a very, very broad political consensus in Europe. The discussions in Europe are largely about how we can best sustain this model, and how we can do that in the most efficient way, but nobody fundamentally disagrees with this. And when we ask the question to ourselves, but what would our partner countries see of value in Europe? One of the things is how we approach health. We see this as an integral part of our social and economic system. Having said that, there's a lot also we can learn from our partners. And we are at a stage in Europe where we are increasingly finding it difficult to sustain what we have built over the years. And therefore, we also need to learn by looking at partners that are addressing this sometimes with fewer resources and therefore have a strong drive towards efficiency, and looking at how we can do this. Now, countries are addressing this individually and collectively. So I note also the very strong initiatives underway, for example, in Africa, the African institutions, African CDC, certainly the African Medicines Agency now, which has been established, and we will continue to support this. The second actor I would mention very quickly is the private sector. Yes, as I said before, in Europe, we see the provision of health services as an essential function of the state, but that doesn't mean that there isn't a very important role for the private sector. The private sector provides the technologies, the equipment, the tools that health systems need. And in this respect, as you know, we have taken an initiative to support local manufacturing. So the MAF Plus initiative, which has mobilized already around 2 billion euros of support to help also realize the potential of the sector, because this is not just a necessary investment. This is also an investment that can pay off because it can create also opportunities for African and European companies, entrepreneurs to join together. And the health sector is an important economic sector in its own right. In Europe alone, the health sector employs 10% of our entire workforce, directly or indirectly. So it shows you what a strong and what a good investment this can be. And therefore, we are working on the MAF Plus on the supply side, de-risking investments, for example, and helping with matching supply and demand. Working on the demand side, so the whole issue of supporting pooled procurement and also working to also consolidate this demand, and the regulatory side, where we have, for example, seen recently regulatory authorities, for example, in Rwanda and Senegal, achieve ML3 with the support of the European Union. Finally, very importantly, to use all the tools we have at our disposal. So in addition, of course, to the instruments that I mentioned, MAF Plus, etc., we also use the research program. The current situation is not just a trade imbalance. The problem is not just that Africa and to a certain extent Latin America import most of their needs. It's also because that means that the health needs of these continents are not always prioritized in research. There are a lot of unmet or poorly met health needs which need to be prioritized. Final actor are the big global health instruments like the Global Fund, and they can play a big role. And I think they are at a pivotal moment. They were designed in the 90s, a very different world. A lot has been done since then. Thousands and thousands of lives have been saved. And that needs to be consolidated and built upon. But the world today is very different. And I think as we are in a year of replenishments, Gavi, Global Fund, Pandemic Fund, we also need to reflect on the role that these funds should play in the years to come, which is precisely to help countries gradually and at their own speed, which will differ from country to country, gradually move towards health sovereignty. I think we need to have this important discussion, but we remain committed, certainly in the European Commission and the European Union, to work with all our partners to achieve this. Thank you.
Thank you so much, Mr. Seychell, for this. What I really liked was that you managed to look at the various role with non-EU actors, so not just partner countries, private sector, but also the global health initiatives, including Global Fund, who's present today. So I would like then to pick up on what you said. Health remains a priority, although it may not be the first thing on the agenda these days. I'm paraphrasing how you said it. Health remains important for the EU, although in discussions it may not be the first thing on the agenda. So I would like to then bring in Marit. So in this constrained financial environment that we find ourselves in currently, how can the EU balance its own national interests vis-a-vis the global health ambitions that it wants to support through the Global Gateway or the Global Health Strategy? And how can Team Europe perhaps work towards ensuring predictable financing for health, given the upcoming multi-annual financial framework and the Team Europe instrument? So how do you think these two can be balanced? Yes, thank you.
Well, I think maybe we have to even rephrase that question in asking, does the EU want to balance domestic priorities with sustained commitment to also global priorities, be it global health or be it other priorities outside of the European Union? And I'm really happy with the presentation of Martin from DG INTPA. But at the same time, I have a feeling that this is where we are right now, but maybe not where we are going into the future. If you look at, I think it has been mentioned, and we all know at the budget cuts that are taking place in various countries in the global north, in the European Union, also USAID, of course, that has cut severely in assistance, also on health. We see that this is a trend which is maybe accelerating even in the future and not stopping at this moment. So I think we really need to be aware and need to also organize ourselves. In that sense, it's very good that we are here today to look at alternatives, but also look at what is needed in this priority for the European Union on its external policy. Because what we see right now, what will be happening, or what is presented to be happening in the future with the new multi-annual financial framework is that many of the instruments that are now under the title of Global Europe are all put together under also the name of more flexibility, under the name of more working on leverage to make sure that there's more possibility also of maybe getting private funds into the work. Whereas at the same time, we have seen that if you look at private funding, if you look at the way in which Global Gateway is focusing, for example, right now, it focuses much more on areas where there is less fragility and less needs, and where maybe it is already possible for the private sector to invest, and there is some extra subsidies there to go into the health sector or other sectors in, for example, African countries. Now, I've heard that the president of the Commission mentioned that health is important in her speech, but I also heard her say that, for example, with Global Gateway, we are going to work on buy European. And when we buy European, we obviously don't buy African because they are different. Which means that if one of the focuses should be health sovereignty, and also focusing on health sovereignty, not just in the public sector, but also in the private sector, where it comes to the production of medicine, of local medicines or medicines locally in African countries. This, of course, contradicts the idea of buying European. And I think here, if we look at this Global Europe instrument, when it becomes more flexible, when NDICI is also being combined with other external action service instruments, it's also going to be much more difficult for us as members of the European Parliament to look at these objectives and to have proper scrutiny to see where the funds are going to, and if they are really going to these aims and these goals that we think are important. So for us, I think right now, in the context of this health sovereignty trajectory, and also looking at priorities for countries in the health sector, we see that when there is a dependency on service delivery from international organizations or from international funds, as soon as they are cut, this is a real big problem. So we need to make sure, and these initiatives I think are really good, to work on public health and to make sure that public health also is an initiative and is a priority in countries themselves. But I think we're going too fast when we say there is a role for the private sector, and 1, 2, and 3, it's going to happen in the near future. Because to be honest, I think we need a transition period to make sure that this is also something that is going to happen. And if I listened again to what priorities we have in the next multi-annual financial framework for the European Union, it's going to be a tough job, and I'm going to need all of you with all your input to make sure that funds are still going to be made available for all the good work that Martin wants to do, because obviously he's on our side. So let's make sure that in his department there will be enough funds to do all the work that he wants to do, and that we can do it together. Thank you.
Thank you so much, Marit. There's so many points I want to bounce back. There's so many points I want to bounce back to Martin, but I will maybe ask so you can reflect when I open the funnel, because I want to get to AUDA and Maël. But how, based on what Marisa shared about the Buy Europe versus the ambitions of MAV+ and how you want to support Africa manufacturing, how can this be then sort of structured going forward that it's mutually beneficial for both Africa and EU actors? So I'll leave you that question as you reflect. So
can I just apologize because I need to leave at 10:15. So it's not that I don't want to listen to all of you, but at 10:15 I will be running out of the room. Thank you.
Thank you for this. So I like the point that you made. What then do countries do when the global, not the global fund, but donor funds diminish? And how are they preparing for transition? And I'd like to bring in this point to sort of share with us your perspective or reflections on how the global funds financing model, including your sustainability transition and co-financing policy, are looking to support not just domestic mobilization of resources, but also to prepare countries for when the transition of the global funds may not be there one day, but then also ensuring ownership of this in financing for these countries.
Thank you. Thank you very much. And good morning, everybody. I think we start with what an honor to be a part of this conversation. And I think it's very important. I love Janet's point. Sometimes we focus on the present, and it's always very important to go back in time. When Global Fund was created in 2002, 2000 actually, it was created as a partnership. And today, when you look at what we're talking about, it's a convergence of what the wall of donors, implementers, Africa, and also civil society. And when you look at the Global Fund model, if not the only one, it is built on that platform of partnership, which brings together these different voices around the table to start a dialogue. I don't want to remind everybody why the Global Fund was created. It was created at a time when the business of the debt was thriving in some parts of the world. And today, if you look at the opportunities that we have unlocked with 20 years, we have been part of that narrative to create a platform to sustain the dialogue that we're talking about, a dialogue on sustainability and a dialogue on sovereignty. But we started from a journey of emergency, where the cost of treating a HIV patient in Africa was $10,000 per year, out of reach in 2000 for Africa. Today, the cost of treatment is less than $50 per year. And when we talk about pool manufacturing, local manufacturing, the voice of the Global Fund at that table is very powerful, because we have leveraged the power of pooling to drive synergies, efficiency, and drive prices down. And given the scale and impact of the investments that we've done in the past 20 years, 72% I've heard today in Africa, and almost 60% implemented through African governments, makes us a critical party in that conversation. We have the tendency to believe that these are mutually exclusive, to say that we could strive in a platform where there is a win-win narrative for both Europe and Africa. Because you can buy Europe and develop Africa. These are not one or the other. Both of them can run together in a way that works for both the continent and also the people of Europe. Europe contributes 30% of the Global Fund funding. If we were to look at it from a business and private sector perspective, you are one of our largest shareholders. How do we integrate the needs of Europe and the needs of Africa in the conversation moving forward to strive for the people of Africa? It is possible. And I have, as CFO, I love these conversations because it has given us the opportunity to listen to the needs of both our donors and the countries that we serve, Africa. But we have the tendency to forget the communities. We don't provide health services for Europe or for governments. We provide health services for the people who need access to equitable care. And when that care is not provided to the people of the continent, as Martin said, beyond health, you unlock other social issues that have no boundaries, because COVID-19 has taught us in the Global Fund that we're not able to deliver on our mission until we stand with countries, for countries to provide services. I'll cite a few examples from COVID. During COVID, it has accelerated our engagement with the AU and with governments. Global Fund was the first organization in global health where we were able to unlock the agility of our partnership and provided $500 million of our own funding as seed capital that unlock $5 billion to drive COVID response, mainly in Africa. When COVID ended, the resources that we had remaining, we used most of it to deliver sustainable health system in Africa. I was privileged.
I'll give you a minute.
Yes, I was privileged to see it in several countries. When you look at oxygen plants, we talk about producing for Africa. Today, when you go to the continent, you have many countries that are producing their own medical oxygen to deliver for their people. That is one of our flagship programs. We talk about regulatory elements. I was in Zimbabwe a few months ago, where now not only do they have the maturity, they're now providing services to other areas of the continent. Just to close, I want to iterate that it's a journey. We need to deliver both sustainability for Europe to make sure that the dependency on aid by Africa or any other country in the world can be mitigated in the medium and the long term. And to my people in Africa, we also have to give them the opportunity and the platform for them to strive and own their own destiny as part of that narrative. And it is a journey. So the next 3 years, especially for the aid replenishment, is not the moment to stop, but it is the moment to start that reflection and convergence to balance sustainability and sovereignty for both Europe and Africa. And we want to remain that partner of choice for Europe, but also the voice of Africa to deliver on that. Thank you.
Thank you so much, Ada. Really so many points I could pull from, but I wanted to just touch on the last one, how to balance sustainability and sovereignty. And I'd like to then invite Mayel to give a reflection from civil society and advocacy. How can you, in your work, ensure, you've heard so much today from the Global Gateway, what the ambitions are, from the reality of where the budget is, and how to ensure that it's serving not just national interests, but also supporting global health ambitions of the EU. You've heard about the need to balance this sustainability and sovereignty. So how, as a civil society actor, can you ensure that the support is truly African-led sustainable? And I mean also being inclusive, right? Because it's not just about what governments can do, but also citizen voices to ensure sovereignty is really being honored. So, and maybe looking forward, what would that look like ideally for you?
Thank you so much, Philomena, and thank you all protocol observed and everything. I just want to start with the point that you made, Ada, about the communities, because I think that sometimes those big discussions are we're losing the focus on why are we doing this. And I think that it's really important to understand. I think I'm gonna speak for Africa in terms of the health pyramid, the health system pyramid, and at the bottom you have 70% of the community health workers who are women, and then the more you climb to the top of the pyramid, and then the less women you find, and then we find around the tables, around decision-making tables, men who are mostly doing the policies and taking the decisions for women's health, mostly because women are the backbone of the health system in Africa, and they are the caregivers. They are at home the caregivers. They are the community health workers, and so at Speak Up Africa, in terms of what we're trying to do is really to make sure that women have a seat at the decision-making table, but not like a meaningless seat, but a meaningful one. So what we're doing is through an initiative called Voix Essentielles that was launched in 2021 and co-funded and strategically supported by the Global Fund and Fondation Chanel. We are supporting the capacity of women and giving them small grants to to make sure that they have a seat at those tables and they are able to really make the decisions that pertain to the health of the people, the health of the communities, and making sure that everyone understand why health needs to be a priority. In terms of this initiative, and I use it as an example, it's how we are really like bringing the actors at the table, but we need capacity training. And I think in terms of the ecosystem that we're seeing today and the shift in aid and all of those like paradigms and perspectives, I think that in terms of civil society, I think that there's a lot of improvement that needs to happen, and civil society needs to not be an afterthought in the design and the co-creations of all of those programs. We need to be at the table, and we need to really lead in terms of like the discussions and the accountability. And so most of the time civil society is an afterthought, and so there's a lot of things that are happening in closed rooms, and then they're bringing civil society at the end and like presenting what is the plan. But this is, I don't know how this could work. And it's the same thing actually for the private sector in Africa, where we are trying to engage them, and we're working with like the national malaria control programs, with the Ministry of Health, and then we're doing all of those like big plans, like advocacy plans and everything. And then we're like, oh, we're going to bring the private sector for this. And then it's actually like an afterthought. And then we're presenting this to them, and then they're like, but what is the win-win for us? So it's like, I think that it needs to like, it needs to shift in our minds the way that we're doing things. And I love and I commend the leadership of Ghana and everything that's happening with the health sovereignty summits and all of those things. I hope that we're like, we discussed this with AUDA this morning, but we need true governance, and we need true honesty in terms of who is at the table when we're making the decisions. We need to stop with the tokenism. We're bringing some people around the table, they're signing some things, and then the rest of us have to deal with them. So I think that it's really important that looking forward, what success looks like is really engaging the right stakeholders with the right intentions. And we're done with like all of the hidden agendas and all of those things. And we're really co-creating and doing things for the people, by the people. And then this is how true ownership actually of health is going to be happening.
Thank you so much, Meryl. And on time, because it was about just to, granted that we started 5 minutes late, we now have 15 minutes for Q&A. So we can move to 5 minutes after the half the hour. So about 20 minutes for Q&A. But I like the point that you made. And maybe I even have a first question. So my colleague Kacha, in our research, we found discussions about lenacapavir, and how, you know, the rollout could happen. Mayel, have you, in any of the civil society groups, been discussing this? Have you heard about any meetings being organized by, for example, the Global Fund or the EU or the AU around this? And maybe to also Mr. Seychell and AUDA and Janet and Wessam online, how do you meaningfully engage with society? That's my question, but I would like to open the panel to be able to answer, but you can maybe in a minute.
So full disclosure, I mostly work on malaria. Yeah. So I haven't been in the rooms with those discussions, but I think that's just in terms of a more like global perspective on like vaccines and all of those things and new tools, great. But at the end of the day, if people are scared of them, if people are not involved in those discussions, like misinformation travels 10 times, 11 times faster than like accurate information. Today we have AI generating most of the information on the internet, and so I think that it's really important again to engage those community-based organizations and women, because they are the ones who are going to pass the message. And so if they're not involved, if they don't believe in those interventions, the new tools, all of the money will have been thrown away.
Thank you so much for this. So I'd like to open up to the floor. I see lots of happy faces, smiles. So I assume there's some questions. And also to those online, if you're able to ask, my colleague will be able to read the questions and relay them to me. So feel free to use the chat button for this. Assad.
Hi, thank you. Assad Beg from the External Action Service. It's related to the Global Health Resilience Initiative. But 3 Ps, one is on politics, partnerships, and perspectives. On politics, what's your assessment of the US disengagement and also the America First Global Health Strategy unveiled in September? And what about China? China's engagement in this area. Second P is partnerships. What about the G7? I think it will be under the French presidency, and then the G20 will be under the US presidency. We also have the Berlin Health Summit in October, the Health Assembly and the WHO next year. How do you see that going forward in terms of getting health on the agenda and also top down and bottom up, as you mentioned, getting also women on board? Last question is perspectives. We're also preparing the 7th AU-EU Summit at the end of November in Luanda with our African partners in a spirit of co-creation. What would be your advice both to the EU? I'd ask the European, the Deputy Director General for his advice to the Africans and the African colleagues for their advice to the Europeans. What would be your advice on maybe the top headline area of cooperation in this field? Thank you.
Thank you. I'm Talata. I'm from EDFI, so the European Development Finance Institutions, and the private capital was mentioned several times. And Ada was mentioning that it's not yet time for the private capital to come in at this scale. And I wanted to ask for concrete reasons why. So blended finance came up also several times. Do you see current reasons to wait, especially as the public money is getting scarce fast? And yeah, if you see potentials on how it would actually be safe to get the private capital in now, maybe also through philanthropic sites, I'd be happy to hear your thoughts on this. Thanks.
Wessam is still online, I believe. Wessam, are you online still?
Yes, I'm online.
Okay, so feel free to ask the question.
So the question for Africa CDC in the chat is, what is the vision of CDC for private sector in African health system?
Thanks so much for the question. So I will pose the questions to the panel. There was a question on the van der Leyen's announcement for the Global Health Resilience Initiative. I think, Mr. Seychell, you can take that one. And maybe the one on the EU, also Mayel from the top-down approach. And Ada, I think the question around blended finance. And Wessam, the question that was just asked now relevant for Africa CDC. And Janet, please feel free to also share your thoughts. Thanks.
The question from the gentleman on the current situation is clearly, certainly the traditional donors are all under immense pressure because the needs have multiplied, and we do not see, unfortunately, new donors coming in on board in the same way. So we will have to manage that. Coupled with that are, of course, important political developments. You mentioned the US. I mean, it's often described as disengaging. They've recently published their own strategy on global health, which shows a shift clearly towards a more transactional bilateral model. We'll have to see, of course, what that will imply. So, that remains to be seen. Clearly, from our side, we obviously recognize that there is a need to reform the global health architecture. I mean, it was designed, as I said, in the 90s, and this is a very different world. Where we differ is what needs to be done about it. We believe that the process should be a more gradual, orderly process based on partnership with our partners, and where we still see a strong role for multilateral organizations, of course, suitably reformed and addressed towards supporting the concept of health sovereignty. On this, we concur. It is dangerous. It would be, I think, counterproductive to leave countries and their populations in a state of extreme dependence. and this links to the question made earlier, which you raised about, what is often wrongly perceived, I think, that we are promoting some autarkic vision of health. This is not that Europe will take care of itself and Africa will take care of itself and Asia will take care of itself. Of course, there's a balance to be struck. We live in a world, unfortunately, which is very ruthless, and where any vulnerability, whatever it is, on health or energy, on defense, whatever, will be exploited. And so the balancing act here is how, on the one hand, to reap the benefits of global trade, which has delivered a lot of benefits, taken millions of people out of poverty. On the other hand, to avoid that degenerates into a situation of extreme dependency. The balance. And this is true for Europe, it's true for Africa, it's true for anybody else. And this is where we need to work together to really define well this concept of health sovereignty. And for me, at least, health sovereignty is very clear. Countries need to be in a position to be able to provide at least basic health services to their population. If a country is dependent on foreign aid to vaccinate its children, to take care of its expectant mothers, this is a very dangerous situation. This is the opposite of sovereignty. So, of course, there will be situations, unforeseen epidemics or outbreaks or other disasters, or where solidarity needs to be expressed. But we are talking here about the provision of basic health services, and this is what health sovereignty should be. So the challenge, and the point you made, is what is on top of the agenda. It has to be that in the coming months and years, we need not only to define what health sovereignty is, but also reshape the global health architecture to make it the instrument of support to countries to be able to graduate. Of course, not all at the same speed. There are countries that will be able to do this faster. And this will mean, and this will be a very important but final point, but very important, this is not just a health issue. We cannot achieve health sovereignty in any country if we do not, for example, look at the domestic resource mobilization, engaging with ministries of finance, how to gradually channel the proceeds of a growing economy also towards human development, including health. We note that even sometimes in countries which are, low income or middle income, the level of expenditure on health has not been matching the economic growth.
No. Thank you. I think your point then leads to what Ada wanted to speak even about the finance aspects.
I almost did not say anything because he just described our STC policy. It's exactly that. When we talk about it's not binary, it doesn't mean we don't see the need. It means that we're saying not all countries are the same. It's a pathway, and we need both the donors and implementers, governments and all, to be on the trajectory and move it forward. And if my message came out that it's not time for the private sector, no, that's not what I'm saying. If you look at our strategy in the last 5 years, we have been amplifying, and it is the fastest growing catalytic amplifier in our ecosystem. We have more than double the amount of resources that we get from the private sector as both catalytic investment to drive innovation, but also accelerate the shift that we're doing. If you look at our investment in health system, engaging with private sector is one of the pathways for transition, for sovereignty. Blended financing, in the last 5 years, again, Global Fund, we have driven tenfold. The amounts are not what we wanted to be, but when I compare 5 years ago to 10 years ago, when we had not a single blended financing, we're now talking about private equity, working with private sector, blending government, World Bank, Global Fund, and other resources to have an integrated approach to health delivery. When we talk about regional manufacturing, the effectiveness of regional manufacturing is at the core of public-private partnership and engagement. If we strive to start to get governments involved in the manufacturing and delivering of commodities everywhere in Africa, that's not sustainability. It's how do we unlock the power of the private sector to drive that. So I will just conclude to say the vision for the Global Fund is exactly aligned to that of the EU, which is around how do we build a network of quality partnerships to balance both sustainability and sovereignty for our donors, but also the governments and the communities that we serve.
Thank you so much, Ada. I'd like to give Mayala a chance to also respond to the top-down approach, because with the summit coming, indeed, this is some of the considerations. How do you ensure that this partnership is not just at the state level, but actually trickling down to the citizens who benefit from health?
How many seconds do I have to?
we are 2 minutes to past, but I'd given us 5 additional minutes for the Q&A since we began late. I hope everyone can bear with me on that. So 2 minutes, and then Wessam.
Okay, great. Just to this point, I think it's a very important one, and I think again it's a conversation that we had with Ada this morning, and I was citing a presentation that I saw from the World Bank regarding the fragmentation of donors. I think our sister from NEPAD mentioned the fragmentation of initiatives on the continent, but there's also at country level a huge fragmentation of donors. And for instance, for the time frame like 2019 to 2023. In Mozambique, there were 221 donors. In Ethiopia, there were 253 donors. So I think that the top-down and bottom-up and all of those approach, I think that it starts with the countries owning their health agendas and owning and mapping out like the partners and every financial flow that are coming within their health approach. And I think that's in terms of like civil society and the partners and the ecosystem, I think that it's important that at country level we start like sitting down and mapping out everything that's happening and assessing the needs and assessing the solutions and assessing what works well and what doesn't work well, because the fragmentation of aid and the fragmentation of programs and initiative is not the best thing to move forward. So I think that it needs to start with like really like understanding and assessing the situation at country level, and then after that like really acting accordingly.
And on time, thank you. So Wessam, I would like to invite you to share your response to the question that was posed for Africa CDC.
Yeah, for us in Africa CC, we believe the role of private sector is very critical, especially with this sharp declining in foreign aid assistance. So, and this is reflected clearly in Africa CC framework for health financing in a new era. We're looking for one of the areas to address this global declining in the funding coming to the continent is having this model of public, private, and also people partnership. So we need the government, the communities, and also the private sector to be engaged to address this kind of declining. The government role to start working on market shaping, enhancing policies, and opening the market for private sector to do investment. But the role of the private sector to do this kind of investment to address the gaps that we are facing. Public investment alone will not be enough to address the critical challenges that we have in the continent. So this model of blended financing is very critical. And regarding the other questions related to the withdrawal of US government from supporting many public health programs. So our Director General recently engaged with the US government to start communicating with them about how can we work together, Africa CDC, different part of US government to address this issue, clarifying different aspects related to the importance of continue such engagement. Again, as I mentioned, it's not on a base of charity or donation, but there are other aspects related to investment, and this kind of investment and sustainable project. This is one of the proactive measures to also protect the US people, and also asking for the support for debt relief because this is affecting many countries.
30 seconds, Wessam.
All right, so engagement on the base of investment, debt relief, supporting sustainable project. This is critical to allow sometimes for our governments to depend on themselves and allocate domestic resources to address different health challenges. Over.
Thank you so much for this. I don't see any other hands raised, so I think, Okay, I give you a minute, Ambassador.
I like what Martin has been saying about sovereignty and being careful of dependency. What has happened, and I'm making reference to many studies that have come out which are not addressed in such fora. If you look at the number of deaths from COVID-19, it gives you a very different story from what we're discussing here. For example, the entire Africa lost, or people who died in Africa, it's almost equivalent to those who died in the UK. 1.3 million Europeans died from COVID-19. Africa was 200. The research has come out and said more warmer places normally didn't experience too much problem. If you look at Italy, Milan, more people died than the rest of Italy. So these narratives, which are driven by drug manufacturers, Africans are dying, we want to get it more, and when you look at resource management, it requires to be looked into. If you just plug in online, you'll be shocked, but we don't address it in such fora, which must be addressed and address really serious problems impacting Africa. But we look at these pandemics and we highlight those things, then we completely make Africa needs to be sovereign in terms of production. But the narratives from drug companies which crowd out local manufacturing is what we need to address to fully have
it.
Yes.
Sovereignty. Thank you so much, Ambassador. I think it goes to the point that Maëlle also mentioned before about having the right information in the public space, because that's what is needed. And I think the support coming from the EU also as well is a different project looking at information support. So that's thank you for raising this issue, and it's something that perhaps we can, as ECDPM, also consider in our research. Yeah, the role of information when it comes to health and how this is disseminated. So I want to thank the panelists. I think you've enjoyed the presentations, very, very candid. I want to thank you all, Mr. Seychell, Ada, Maëlle, who are here with me in Brussels, Wessam and Janet online, and of course, Marit, who had to leave us, and Ambassador Tachie-Menson for delivering the keynote speech, which set the tone for the event. So I will pass on now to one of our partners to give the concluding remarks.
Thank you very much, and I will be brief. I really like this, all protocol observed. Thank you, absolutely everyone, and including, of course, ECDPM for this analysis and research. So I think we can acknowledge we are in a time of turmoil when it comes to global health, but also beyond. And I think in a time of turmoil, we have to know what we need to let go of, but also what we need to lean on. And what I hope this research brings is more arguments and evidence that the Global Fund is really a pillar of the global health architecture and can be a pillar of a reformed global health architecture that brings indeed greater dependency, which is, I think, what our African partners were calling for today. So thank you very much for being here with us. I hope this report will spark conversations and give ideas on a better integration and alignment of the Global Fund with the Team Europe initiatives, with the Global Gateway. So I really hope it's only the start of this conversation, because much more can be achieved by creating and joining these synergies, and we need to have better and greater impact. It's a grim time, but it's also a time, we've mentioned Nanakapavir, where we have huge innovations coming ahead. So it is also a moment of hope. And we hope that leaning on the EU's commitment to ending HIV, TB, malaria, its leadership in global health, its leadership in in continuing supporting the Global Fund. We hope that we will have a bold replenishment, of course, of at the G20, and that the Commission will continue supporting this initiative, which is, as we've seen, also extremely strategic in its relations with Africa. Thank you.
So thank you so much to everybody who traveled to join us for this breakfast launch of the report. And again, the report is available on our website, so feel free to have a look afterwards. To those online, thank you for staying with us. Thank you for joining us. Wishing you all a lovely day.